Hello, sir. Hello, sir. Mrinmoy, sir. Mrinmoy, sir. Sir, you are not audible, sir. Sir, you are not audible. Sir, you are not audible.
Not audible, sir.
ठीक है ठीक है ठीक ठीक है Sir is rejoining, so wait for the 2 minutes. Not audible, sir, not audible. Join with your audio something. Okay, rest.
Hello, am I audible now?
Yeah, sir.
Okay, yeah, right now it is audible. Yeah. So I'll just make the video enable, and I just remove the like the microphone and all. That's why it was causing some issue. Okay. Yeah. So am I audible clearly, clear and loud to everyone?
Yes, sir, audible now.
Okay. So today's webinar is all about harnessing the growth in healthcare, which is the vision of India also 2030. And today here with us, actually I am presenting IIHMR Bangalore. I'm working here as an assistant professor, and I'm taking care of pharmaceutical management and also some part of health IT management. So with that, before starting the presentations and before starting the session, I'll request Lambodar. He's taking care of the information technology here and all the setups to run the college campus video and campus tour. Yeah, Lambodar, please go on. Yes, thank you, Lambodar. So with this, we are actually starting our session today. And John Dewey, one of famous American philosopher and also psychologist and educationist and education reformer, rather I say, once said, like, education is not preparation for life, education is life itself. So with that thing, like when we are educating people, education depends on like hands-on practices, practical applications. So he believed that education should be based on learnings by doings, and also not on like memorizing the any kind of like theory or anything related to like textbook aspects. It is also facts and following the authority. And he founded an experimental school in Chicago where children learned through activities and also through like projects and problem solving. So with this, like I'm talking about our institution, which is IIHMR, Institute of Health Management Research, Bangalore, which is having a legacy of since 1984. It's a legacy of almost 19 years. And we have started since our inception. It's a record-breaking placement, what actually we are boast of. So that is what it is. Like history repeats itself once again this year. We are once again achieving the same feat. So just setting the background and setting the context, I'm just sharing my presentations. And this session will be a kind of interactive sessions with all of you. And if any questions and any queries, if you have, you can ask in the end of the session also. And even you can stop me anytime. And along with me, I have one of my students who is actually reading and studying in current batch in second year, and he's already placed. Okay, so we'll be hearing from him also, how he has experienced, how his journey is all about. And not only that, from where he started, what he has achieved during last 1.5 years of course, and what and all like in the society he has proven himself accordingly. So like that, with all of your regards, I'll just start sharing my presentation. Just let me know if my slides are visible. Yeah, I hope my screen is visible to all of you.
Yes, sir. It's visible. Yes.
Yeah, so a brief background of mine, like I'm a certified good clinical practitioner and good pharmacy practitioner. Basically, I'm a pharmacist. And after that, I did Master of Business Administration. And currently, I'm doing a PhD, which is about to finish from LPU Jalandhar, India. And almost I have 14 years of experience in the industry. And I work for the companies such as Cipla, Lupin, Glenmark, and AstraZeneca. So I was one of the person involved in the launch of Covishield vaccines here in India and Southeast Asia. And I also have research publications, which is indexed in Scopus, UGC Care, and Google Scholar. A brief background of me. So if I say like background of the Indian healthcare industry size, so it is almost taking care of 372 billion, and it is going to be poised at by 2025. So there is a huge requirement of manpower, which is catering to the entire business of this Indian healthcare system, be it in medical tourism, be it in pharmaceutical sector, because India is becoming hub for pharmaceutical sectors. Because as per the pharma vision, we are into today's session of healthcare reforms, as well as like what actually we are taking care of depends on harnessing the growth. So what it takes particularly to being into that position once again. So India is becoming actually claiming that position. Earlier, India was in that position. Right now, it is reclaiming that position. Okay, so in that case, like there is a medical devices industry, there is hospital industry, there is healthcare industry, there is public health, and India is contributing to the entire world in terms of pharmacy, being into the pharmacy of the entire world, in terms of applications and in terms of technologies, everything. So if you actually ask me, starting from 2008 till now, okay, so here is the growth prospect you can see here, and there is a huge requirement of which is the employment aspects, or which is the manpower requirement of 7.5 million, which is huge, 75 lakhs of manpower requirement by 2025. And also there are huge number of reforms which is already being happening due to this COVID-19 scenario. Like it has learned, and we have learned a lot of things due to this COVID-19 things, because COVID-19 taught us a lot of things which is we could not been achieved before that. Okay, it is terms of digital health, it is terms of any kind of applications, remote patient monitoring, or even like tracking or any patients who is actually having the vaccinations or not, whether it is related to public health, whether it is informatics, anything as of now. So like that, if you ask me like what and all these segregated sectors in the healthcare, what we have. So total Indian healthcare industry, which is size by segment, if I segment it, it is having healthcare delivery hospitals, then medical equipments and supplies, then pharmaceuticals, health insurance, and diagnostics. So it is the total gamut of the industry, which is 61.79 billion. And it is actually there on financial year 2017 and expected to reach $132 billion by 2023, growing at a cumulative annual growth rate of 16 to 17%, which is far more better than any other industry. That is why people are saying that this is the recession-proof industry. Because right now, each and every day, we are seeing that, yes, there is like layoffs, there is like kind of even kicked from the company. And also even they have given employment. And then after that, when the person reached out to that place, maybe in US, UK, wherever, they are getting jobless. But here is the industry, which is we actually foolproof, which is the future-proof industry. And there are huge requirement of manpower. There is huge segregation of places. There is huge segregation of the sectors. Okay. So if you see, everything is here only because the entire systems taking care of or complementing the entire healthcare systems of India, and not only India, India becoming the hub for pharmaceuticals, medical devices, applications, softwares, whatever it is, whatever it takes. Okay, India is exporting, started exporting medicines also. We have seen that, okay, during COVID-19 scenario. So this is the background here. And there is a growing disease burden also. If you ask me like, what is the next 10, 15 years scenario of India as well as Southeast Asia, because there is a huge healthcare burden on India as well as in Southeast Asia because of NCD, non-communicable diseases. And there is this kind of disease burden, like if you take diabetes, if you take cancer, or if you take any kind of other like long-term chronic diseases, all are actually contributing to this kind of factors. Okay, so there is a requirement of 3 million doctors, the requirement of 3.5 million beds, and also 6 million nurses. And this is the demand for next 20 years. But who will manage them? If you are actually working in a hospital where each and every doctor, each and every nurses, each and every like technicians will be reporting to somebody, which is the administrator, who is actually administrating each and everything. So who will be administrating them? There is a requirement of management. There's a requirement of art and science of management, which will be taking care of each and everything. Whether it is business aspect, like business analytics aspects, okay, where actually we are taking care of ROI, okay, because we have invested something that should be coming out in terms of maybe number of beds, maybe number of patients, maybe more number of footfalls in the hospitals. So that is how it is actually looking into. And if you ask me like, what is the background of IIHMR? As I said, like the education reforms itself says, or even like the philosophy of education itself says, actually, if you teach me by reading, or if I see by reading, or if I read only the theory, I'll be not knowing much things. Okay. But if I do that, if I do the practical or even hands-on, then I'll be learning and it will be a lifetime learning. That is what the philosophy for IIHMR. And IIHMR having a legacy, which is started in 1984 and specialized in research, actually mainly educated for postgraduate educations and training organization in the healthcare sector. And it's having 4 branches. First one is in Jaipur. It is the 65th in the prestigious NIRF ranking, 2020 ranking. And among the top 1%, which is the niche segment in the entire India of management institutions in the country. So I'm not boasting of, but the thing is IIMs and ISBs actually following the curriculum of IIHMR. If you ask me, so why actually I'm telling that? Because we have a full-term program, which is PGDM, which is a 2 years program equivalent to MBA by AIU. Okay, Association of Indian Universities. That means what? That means after completing PGDM, you will be eligible for going for further studies like PhD or even going for international placements also, because it's been regarded as this kind of degrees. But what IIMs or ISBs are doing, they are giving only certifications. They are giving maybe 6 months or 12 months certification, that too in online. But how much we are learning through online? As I said, the education reforms, even like not only in US or not only in UK, everywhere it is said that unless and until I'll be actually attending patients, I'll be giving them therapy, I'll be not learning much. That is why doctors are practicing. That is why you are also practicing. Okay, that is the reason here. And we are the institutions which is actually following this philosophy. We have observership where students are going to the hospitals, they are learning from observing them and getting the hands-on practices. Okay. Then also we have internships. I'll be discussing one by one, but I'll be giving you brief first. So that is how the things are. And we have a legacy of healthcare with 35 plus years of presence in the healthcare and recognized as Institute of Excellence by Ministry of Health and Family Welfare. And also we are the WHO Collaborating Center, which is the WHO, World Health Organization. This is our legacy and this is the journey over here. So I'll be not taking much time discussing this thing, but I'll be giving you the glimpse of this IIHMR Bangalore mainly. Because the inception of the institute happened in 1984. As I said, the legacy starts from 1984. Then education program started in 1996. And also South Campus started in 2004. And in 2010, Bangalore campus received the AICTE approval for PGDM courses. And IIHMR granted as an university, the state university in 2013. And 2014, actually, IIHMR Bangalore received NABET accreditation, which is consultancy organization for NABH, which is required particularly for quality and also for the standardization parameters for the hospitals. And in 2017, we have introduced the healthcare information technology, that is a new specialization. And in 2018, IIHMR Bangalore receives MBA equivalent by Association of Indian Universities. I already discussed that. So you'll be having some questions like PGDM program, whether it is kind of a graduate diploma or postgraduate diploma, how actually I'll be getting jobs and all. These things giving the clarity, like if you are getting into this program, you'll be getting an kind of an approval system that yes, you are eligible for anything related to further studies, maybe PhD or anything. Maybe you'll be actually placed that in the like international organizations also. And in 2020, there is an expansion of pharmaceutical management, which is actually I'm the part of. Then what and all key verticals IIHMR will be having? Like we are already having academics, we are already having trainings, we are already having research and publications, consultancy also. So mainly we have 4 specializations like hospital management, health IT management, pharmaceutical management as also. And we have approved seat number of 120. And as I said, since inception, we have 100% placement record. None other batches actually having, none other institutions is having this kind of record as of now. Okay, so that is the actually we can actually be proud of. But the thing is, we are working hard particularly to achieve that. Okay, and if you ask me like what are the research projects we are being part of, like implementation research from government of Karnataka, even government of India also, we are being part of participating in ICMR researches also. And we are having mixed method research, then large scale survey, then social assessment, okay, and also formative and impact assessments, then health system strengthening, nutritional and health, maternal and child health, and also urban and tribal health, and IEC and social behavior change communications, mainly required for teenagers who are being into the drugs or who are being into the tobacco, like means using tobaccos on their daily life. So we are being part of into the society, like where we are educating the society, creating awareness, and also our students are being part of into the public health and health management and health system strengthening also. So there are a huge number of requirement in that segment where is the public health is poised at. Okay. So we are also having training and placement cells, and here is the part of training and learning development where it's a center of learning and development aims to improve and enhance the management practices and skills among the healthcare industry stakeholders and amalgamating the aspects of technology, healthcare, and business. So we have long-term, we have management development programs and student-focused training programs also, and even certification programs also for short-term, for executives level and webinar series. So these are some of the glimpses of the training programs and certification programs, be it in certificate course in integrated digital intensive care, then nutrition and health, then also having quality assurance and accreditations of healthcare, executive program in hospital management. Then also we are having training partners who are like RxDX Hospital, then University of Mysore, Maastricht University in Netherlands, HX Central Organization, Cloud Physicians, VGU University in Jaipur, Burjil Hospital, that is actually international placement for students. So like that, so we are having plethora and gamut of opportunities, particularly where students are gaining the advantage of learning, and then after that getting into hands-on practices. Then after that they are getting placed, and they are actually knowing all these things before getting placed, because they are doing all these things on their own purposes in the observership, internship, as well as dissertation programs. I'll be coming into that. So moving ahead, as I said, it is a postgraduate program in hospital and health management in 2 years full time and having 4 specialization. So in the first year, you'll be learning all the subjects which is actually required for health system strengthenings and all, be it in like kind of a health like health economics, digital health, or even like marketing of hospitals. Okay, but in the second year, when you'll have to choose some of the specializations, that time if you are choosing hospital management, it will be directly giving into the core hospital management aspects, core hospital management modules. Same thing for health management modules, same thing for health IT managements and for pharmaceutical management. So if you want to know more, you can ask me questions at the end of the session. We can give you more detail about that. So moving ahead, if you ask me like how our institutions are being ranked or how our institutions are being looked into when all over India NIRF ranking, or like how in the management institutions list and all. So here we have an impeccable success record in India's top business school. We are coming into Outlook. In the year 2021, we are having a 10th rank. Right now, we are jumped at 7th rank in 2022-23. And we are being ranked at 19th in top 50 non-IIMs B school survey in 2021 by Academic Insights. And ranked 11th also in Bangalore by The Week magazine. If you have seen, like they're also giving all this periodical list of management institutions. We are being ranked at 11th on that. And we have also got awards from Times, which is Outstanding Academic Institutions Award in 2022. And key achievements till now, like 1,000+ industry-based training programs for executives and students, 800+ health research projects already been done and still going on. 100% placement record I already discussed a lot of times, and 80+ regular recruiters we already have, 4,000+ alumni based across the globe. So if you ask me, like small hospital, maybe nursing homes, or maybe like corporate hospitals like Fortis, Apollo, or even Medanta, Care, okay, all these hospitals, if you ask there, like from where you have done your PGDM or from where you have done your masters or whatever, or even like for health and hospital management training programs and all, 1 or 2 executives will be coming from IIHM. So that is the legacy what actually we are carrying forward. So accreditation and empanelment, if you ask me, it is related to, as I said, AICTE, which is giving the technical approval for postgraduate program in hospital and health management. And also National Board of Accreditation, which is NBA, registered with NIRF, and also awarded as MBA equivalency. I already discussed, this is the 3rd time I'm telling, because this means a lot. That means people having a kind of a confusion, or maybe they have a misconception that yes, if I do PGDM, whether it is equivalent to MBA or not. My friend is doing MBA. Okay, why I should go for PGDM? Okay, so all these things. So this will be answering the all these queries and questions that yes, it is given by Association of Indian Universities, that yes, if I do PGDM, which is equivalent to MBA, and I can do further studies if I want, or otherwise I will be eligible for any international placements as well. So that is how it is. And we have empanelment with Har Ghar Jal, which is a Jal Jeevan mission, which is the actual initiative from the government of Karnataka. Then NHSRC, implementation research for health system strengthening. Then M&E project from Karnataka Evaluation Authority, National Health Authority, like facility assessment of healthcare entities, and NABET, of course, like National Accreditation Board for Education and Training. So it is accredited as consultancy organization for NABH by the National Accreditation Board of Education and Training and Quality Council of India, which is itself is kind of a like we are proud of, because we are a partner of Quality Council of India, and the education also itself, it says that yes, it's measured by its quality. And collaboration and tie-ups, I already said about few of them, like for universities, if you ask me, Maastricht University, Netherlands, VGU, Vivekananda Global University, Jaipur, BNM Institute of Technology, Belgaum, then Mahidol University in Southeast Asia, and University of Mysore, then healthcare technology like Renalix, extending renal health, then HX Central, then Cloud Physician, RxDX, Bionic Yantra, healthcare delivery like Burjil Hospital, Sanitas Hospital, Rajarashwari Medical College and Hospital, Sakra World Hospital, Narayana Health. So if you ask me, last year, Burjil Hospital have taken almost 5 to 6 students, and they're doing really well. And they're being placed at Abu Dhabi, then Dubai, and all these international places. And even international agencies, which are apex bodies such as WHO, UNICEF, ICMR, then NRHM, NGOs and trust organizations such as United Way, then ACL Foundations, HLL Life Care, then Boruka Charitable Trust, then private organizations such as Novo Nordisk, JSW, Sakra World Hospital. It's just name a few. Like there are more than 80 plus regular organizations which are actually recruiting from our institutions. And success stories with placements within 60 days. And right now also it is actually the placement season are going. So highest package last year, it was 24 lakhs per annum, and median package was 6.5 lakhs. And one of our current student, Mr. Shiva Shai, Dr. Shiva Shai actually with me. So Shiva, are you there? If you can hear me, you can just, I'll just stop sharing my.
Yes, sir. Yes, sir, I am here.
Yes. So welcome, Dr. Shiva. So he is actually one of our proud student and actually working in one of the organization, and he is heading the Karnataka operations, right?
Yes, sir.
Yes.
I'm heading Karnataka State Business Development, sir.
Yes. So my question to you is like, if you can just share your journey, like when you were started here, and after that, what and all you learned here in last 1.5 years, and right now who you are exactly, from where you started and right now who you are. Please go ahead.
Yes, sir. Yes. Hi, friends. I think I'm audible to each and everyone here. I think, are they still hearing us?
Yes, sir, you're audible.
Yeah. Thank you. Thanks a lot. Actually, I'm a dentist coming from Andhra only. I had studied my dentistry in Narana Dental Hospital, Nellore district. I think everyone are happy that if I speak some Telugu. Is it okay?
Yes, sir. Yes, sir.
చెప్పండి అమ్మ, కొంచెం మాట్లాడండి, పర్లేదు. ఎందుకు అంత కామ్గా ఉన్నారు? See, I started as a dentist. After dentist, COVID has hit us very bad. At that year, I had worked as a government duty medical officer. After that, I had treated nearly 3,000 patients. I had worked in police department. And before that, 1 year, I had worked as a clinician in rich group of hospitals, where I had opened nearly 14 branches of dental clinics. Next, after that, I thought I had to study more. But considering the PG of our dentistry 3 years, I thought that I'm going to waste my time and money. I should not tell this, but I felt so. So I had choose IIHMR college. After coming to IIHMR, it's completely a different story. వీళ్ళందరూ అనుకున్నట్టే బెంగళూరుకి వస్తే ఎంజాయ్ చేయొచ్చు ఆ ఫీల్తో వచ్చాను. బట్ థింగ్స్ చేంజెస్ హియర్. ఇట్స్ లైక్ వెన్ యూ జాయిన్ ది కాలేజ్, ఫస్ట్ థింగ్ యూ విల్ అబ్జర్వ్ ఇస్ యూ హ్యావ్ చేంజ్డ్. మీలో మీకు చేంజ్ కనిపిస్తుంది. యూ విల్ సీ ఎ ప్యూర్ చేంజ్ ఇన్ యూ. From normal dentist or a clinician to a leader. Leadership qualities perutai meeku first thing. And when you become a leader, you will prove yourself. You will try to prove yourself. I used to participate in different cultural events like dance, let it be dance, sports. I am the class representative of my batch. I am the placement cell representative of my batch. And I am I had nearly 3 to 4 committees on my shoulder. I am taking care of. And coming to the institutional level participations and all, to be frank, Mrinmoy sir, he is my first mentor in the college. Thank you for mentoring me, sir. Who had presented in the prestigious IIMB college in Bangalore. A dentist talking about technical terms and software skills is completely different. I've done many courses. When I came to IIHMR, they will guide you what course you had to do, what presentation you had to do, how to present yourself, how to present the presentations in front of the authors or else international speakers. I got a chance to attend many international webinars and many international conferences. I had mostly concentrated on IoT devices, Internet of Things, like your smartwatch, your mobile, everything. With you, by the use of IoT devices and all, we had saved blood in blood banks in nearly 600 bedded hospital, St. John's Hospital in Kormangla. It's like completely a whole package of journey. And when it comes to curriculum also, you doesn't feel stressed here. You will be keep on learning without any burden. This is a stress-free environment where you can stay in college up to 4 o'clock. After 4 o'clock, it's your stay. Is it so, sir? Yeah, this is a
Shiva, I remember actually we are playing badminton and I jumped.
Sorry for that, sir. While playing badminton in our college,
it was competitive enough. So students should know like how we are enjoying. Means
Yes, sir.
you tell about me, like how I was enjoying with all of you playing badminton, and
Yeah,
I
yeah.
jumped, and then after that I got a surgery in my leg.
Out of excitement and enthusiasm, sir jumped to pick my smash, and he got a leg tendon tear. He was bedridden for 2 weeks. Sorry for that, sir.
No. Actually, I feel proud when I'm talking to you, and when we are together. We both of us presented just in December, friends. So all
Yes.
students, for all of you, in December during 12 to 17, we were there in IIMB, Indian Hospital Management, Bangalore, and both of us are actually feeling proud that yes, and I'm feeling proud of him. Like, and also he's telling just now, he's telling that yes, being a doctor, how he's talking about IoT, how he's talking about like remote patient monitoring, how he's talking about saving the patients, saving the blood banks, and solving the problems of blood banks. That is the learning, that is the applications what actually we are doing here. Yes,
Sir, if you
please
don't
go
mind,
on, please go on, please go on.
can I interrupt you for
Yeah,
half minute? It's like after coming here with the help of Mrinmoy, sir, I had presented one paper, and I had written one paper, like it has been published in International Journal of Research. That is about the transgender healthcare access all around the India. I myself visited 50 transgenders. I went to their place. I had done my research work. I had published my article, and for that I got one award also, Young Researcher Award for the year 2022. Without IIHMR, this would have not been happened, to be frank. Yes, sir. You can have it.
So this is the life for all of you actually students. I'm telling you, like, here is the example in front of you, Dr. Shiva. He means being a dentist, like he has totally what he has started when he has started. Right now, he has completely changed. He is actually means a lot of people are reporting to him right now when he is taking care of the entire Karnataka. So you can imagine like how he is, and he's having leadership quality. That leadership quality actually imbibed in him. So that is what some people are being born leader. Some people are learning from the situations. So both of you will be balancing your life. Your life is not about only reading or only applications of thought or something like that, but how you are becoming presentable in front of you, in front of others, how you are looking yourself when every morning when you are going before going to your school or before going to your college, how you are looking at in the mirror. Okay. So see, the thing is, you actually can beat yourself. Always remember this. That is how it is. Okay, with that, I'll just take 5 to 10 minutes of finishing of the presentation. Then after that, we can take up queries. So Dr. Shiva is already there. You also can answer the questions of the students. Okay, so don't fear anything. Don't get scared because we are all friends. We are all learning together. And here, nothing is like teacher student because everybody is respectable. So we are also respecting each other accordingly. Okay, it is all about that. Dr. Shiva will be telling you more. So accordingly. So I'll just finish up my
I will feel you as my big brother, sir, rather than a staff or professor.
Yes,
the professors which you find in IIHMR, every one of them are down to earth. You can go directly to them, talk freely as if you can feel them as your friends. And one more thing, if you are very much worried about your communication skills that you had now in the dental sector, they don't concentrate on the communication skills and all. But when you are entering into the IIHMR, first thing they will filter you. They will make sure that you are equal to each and everyone in the class. They will develop your communication skills. You need not worry about your communication skills. If you had some stage fear, don't worry about it. Completely, you will be zero stage fear kind of person at the end of the course. That one I can assure you.
Yes, thank you, Dr. Shiva. So just friends, just give me 5 to 10 minutes. I'll just finish up my presentation. Okay, then we can take up the queries. Yeah, so I was talking about, I hope my screen is visible once again.
Yeah, yes. It's visible.
Yeah, so these are the recruiting partners what we have. Okay, and this is just a few number what we can accommodate here in one screen, but there are others also. So like that, every year actually we are getting queries that yes, we want more number of people to be getting into our team. And this is actually, we have taken Shiva here because the thing is, he is actually an example for all of us, for all of our students. And here is the snapshot of other people of his batch. Okay, so they are being placed at companies such as Phoenix, Primera, then also AIOCD for pharma, then Deloitte US. Okay, so these are all our success stories. These are all our proud batch, current batch itself. So it is not yet completed. Still, they are actually doing online classes. They are coming into the campus. They are finishing up their modules, but they are being placed. And even alumni endorsement. So Dr. Neha Bish, which is a product manager in Stanford Health in USA, she's also telling and giving like testimonials in even in internet also. And even Pragna Panigrahi, also like senior healthcare IT consultant in Deloitte, and Pratip Sinha, managing director, Devi Healthcare Center, Malda. And not only that, even IIHMR Bangalore also builds career for students, which is creating future healthcare leaders. So these students have actually got certifications from American universities also, concurrently doing the course here. And not only that, they have also presented paper, as Dr. Shiva has presented a lot of conferences. Few other students also presented papers. These papers got selected in eSport 2022. It has happened in Los Angeles in US. And of course, actually they have presented during that time, the COVID was there, like second wave was there. So that's at that time they have presented online. And yes, this is actually the award for Dr. Shiva. Okay. And she is our Dr. Usha Manjunath, our director, who is actually awarding him also for this Young Researcher Award 2022. It's a huge achievement for him. So that is how it is. So he has actually cited the examples for all of the students who are going to come. And life, if you ask me, it is very, 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 very colorful. Okay, so these are the things. So center stage, once again, Dr. Shiva is dancing, you can see. Okay, so even
I have in each and every slide, I think, sir.
yes. So each and every slide he will be there, and also there are other students also who have participated in lot of things. And even not only that, we are celebrating each and every festivals, and across the culture, across the religion. We don't even bother about anything which is actually separating us, because we are having students from entire India. All the states are representative here. So like that, even convocation ceremony. So every slides actually it is there. And our team, we have chairman Dr. Nagendra Swami, then Vivek Talaulikar, Dr. C.S. Kedar, who is a retired IAS officer, Dr. S.D. Gupta, in his name, S.D. Gupta College of Public Health, S.D. Gupta School of Public Health is already there. He is a proud alumni of Johns Hopkins University, US. And Dr. Ashok Agarwal, founder trustee. And of course, Dr. Usha Manjunath, who is our director, and the Iron Lady of our institution, and Dr. Salla Raju. She is associate professor and associate dean of research and publications. And even chairman, like Academic Advisory Council and all, chairman, Mr. Sunil C.N. Sunil Kumar, H.S.N. Rao, then Chandil Kumar, then even Dr. Kirti Uday. So she's our dean academics. Then intellectual capital of all our professors and everyone, like even including me also. And Dr. Deepa is there, Dr. Gautam Ghosh, Dr. Gyan Chandra Kashyap, Mr. Piyush Kumar is there. He is actually associate dean for trainings and all. So thank you, everyone. Thanks for this opportunity. And with this, I'm just opening this floor to questions. So we can handle the questions and queries, whatever you have. Yes, feel free to ask questions. Even in Telugu also, because Dr. Shiva is there, he will be actually a friend to you. Yes, if you want to actually type the questions, you can type in the chat box also, if anyone wants to know.
Open the questions adagandi brother, em parledu.
Maybe when they are thinking about the questions, you can discuss something more also about your journey.
Sir, you tell about yourself to us, sir. How you had started, how you had landed up as a professor, you had the great marketing.
Yeah, so the thing is, I'm from the industry, and I started my career long back, 2006, 2007. And after doing Bachelor of Pharmacy, and then after that MBA. Okay, any question? Anyone wants to ask some questions?
Yeah, I think someone is speaking.
Yeah. Please go ahead.
Shall I call out some names? I can see some names here. Do you have any queries? Hey, feel free to ask, no worries.
Maybe they're thinking that I'm a professor, so like what can be done is, like, I'll be just stop my video and you can take up the questions. Then actually we can just solve this. Maybe.
Yeah.
Is it okay, all of you? Are you getting scared of me?
Shrivalli, are you there? Hello. You can just speak. Anyone?
మళ్ళీ మాట్లాడతారు వద్దు వాళ్ళు.
Yeah, Harichandana. Think you initiated the speech. Hello.
In the cold, no. How hard is
I can't hear you properly. Hello.
next number?
Hello. Yeah, sir.
Hello.
That she's asking how difficult is actually the course when compared to whatever they are studying right now, the dentist.
So if I want to compare this course with the dentistry which you are learning now,
Yeah.
it's not at all difficult. You can easily secure marks here. You can easily enjoy your life here. Just a little bit of reading is enough, but you will gain so much of knowledge here. That's what I can assure you.
Okay, these are all dental students, right, sir? So what is the scope of course when they opt for this healthcare management?
Yeah.
What is the scope in the future? How they'll get the jobs? Or
See,
only
there is a
in
campus
India or in other countries is it valid or the course? If it's valid in
Sir,
other
Mrinmoy,
countries, so what
you
are
have
those
to take this.
countries?
Mrinmoy, sir, you have to take this question. They're asking about international placements and national placements.
Yes, yes. So as I said, like we have partnered with organizations such as Burjil Hospital, then Sanitas Hospital, Southeast Asia. Then also there is Maastricht University, okay, and some other organizations as well in Africa, and even some of our alumni. We have a contact of alumni of 4,000. We are having legacy of 4,000 plus alumni of IIHMR society. They are being placed at big organizations in all over the world. Okay, so if you're talking about this current batch, as I said, like as of now, there is a legacy of 100% placement. So after completion or before completion itself, they are getting placed, and after completion also, they are getting a pay hike or even rise up to the next position also. We have examples like there is a student in last year batch, Mr. Harish Ramanathan. He is actually heading a technology domain in one of the organization here in Kerala. Okay, so he has joined as an executive, and he's having a background of engineering. So similarly, right now, if I'm giving example of Dr. Shiva. So he is a dentist basically. Then after that, he has undergone this PGDM program. So after this, he has been placed directly as a Karnataka or state head or even operations head of Karnataka. Okay. So not only that, there are students who are being placed in Burjil Hospital last year. Even Burjil Hospital also coming this year for recruiting few of the students. And consultancy programs are already there, such as Deloitte, ZS, okay, and even companies such as Primera and all. They are giving these kind of opportunities where they need this kind of mix of technology as well as science or technology as well as even medical science, or the blend of each and everything. So that is why there is a huge requirement, huge manpower pool is required, where we are providing the solutions for recruiting them, particularly for those organizations. So that is why the secure future, and for everything, like you have to enjoy the life as well as you have to take the life seriously. If you have to learn from what actually you are thinking or what you are learning from your professors, those things you have to apply particularly in your each and everyday stages, and as well as then after that you will be growing. That is what is happening in IIHMR. So in front of you, the example is Dr. Shiva Sai himself. Okay. So even before completion only, he has got placed, and when he'll be getting convocated, maybe he'll be getting promoted also in the next level. So that is how the things are. So this is the success stories, what we are actually being boast of or being proud of.
Actually, I was joined here as a manager in the beginning level before 1 month. After 1 month, I don't know how I got promotion, but due to the skills which I having, due to the communication skills, or else due to the managing skills, or else marketing skills, or else sales skills, whatever it is, I just got promoted as head for the business development. That change I had never expected in my life. but it came very early. That one I can assure you. Someone has
Yes.
raised their hand. You
Yes,
can
we
ask.
only, yeah.
Sir, can we know the fee structure?
Yes, fee structure is 7.5 lakhs, excluding the hostel charges. And you can actually break up the fees in terms of maybe like 2 years down the line. And there are also some scholarships are there. Those things, there are numbers already given in the like brochure. You can directly get in touch with them. In detail, they'll be providing it.
Yeah, you can apply for bank loans also. Banks are eagerly waiting for your educational loans. You can apply for bank loan and study. No worries. After completing this course, after a year, you can repay back them.
So that is what, like, secure future. And one of the thing is like, if you are thinking that yes, it is very tough or very hard, it is not very tough, because all faculties here are there for you. Each and every stage, wherever you are facing any kind of difficulties, you are facing any kind of obstacles, we are there to handhold you and cross that barrier. So that is what has happened with not only Dr. Siva, happened with a lot of people. Okay, it has
And one
happened
more-
with the second. Yeah.
And one more thing, being dentist, everyone are afraid that you will get in touch with Max again. I hope so. Don't worry about it. There is one subject called finance, and the faculty who teaches the finance are CA faculties. You need not worry. They are kind of outsourcing. What do you call them, sir? Outsourcing kind of faculty, or
Yeah, they are external faculties. They are from the
External
industry. So we have external faculties for each and every subject, each and every module.
they directly come from industry itself.
Yes, they are the experts from the industry.
Yes, sir. You need not worry about the subjects. You need not worry about the max and fees. Banks take care of it.
Yeah.
Yes. Hope you. I think I cleared your doubt, Srivalli.
Yes, any more questions we can take?
Sir, is this course for 2 years, right?
Yeah.
The whole structure is for 2 years, right? Or per annum?
Yes, 2 years.
The 7.5 lakh, which was told before, is for 2 years.
Yes, for 2 years together, all together.
Not for 1 year, it's for 2 years.
Thank you, sir.
Yeah. And
Yes.
after 1.5 years, I got placement here, sitting as head for business development in Mediva company.
Yeah. Yes, any more questions?
Any more? Sashidhar, boys, come on, speak up, man. Krishna Sai.
Okay, so the thing is,
Sir, do we have to deal with max?
basic maths will be there. I think I'll not tell you live or something. Yeah.
Just, I told you, right? It's just 10% of the max, just 10%. In whole 2 years, we'll have to deal with max just like 10%. Directly, the CA experts will come and teach you. You need not worry about it. You just go through the classes. That's more than enough. You need not work hard on it. It's just basic easy max.
Yes, somebody else. Kutta Reddaya. Yeah.
Hi, sir.
Yes.
I need to know what are, in which segments after this course will have job opportunities, like in marketing, especially. I need to know.
Okay, so if you are working in hospitals, so you will be seeing that there are courses such as like quality operations, okay, then also marketing, and then also sales. Then marketing and sales is similar domain, but it is quite different domain, because marketing, actually you are strategizing that things when sales people are doing that or implementing that in the field. Okay, similar thing happens for any software company, which is actually right now taking care of the health IT segment. Okay, and even pharma, okay, like pharmaceutical. So in pharma, a little bit difference is there, which is actually related to product management team, where you are managing a product, then after that you are strategizing for its entire revenue generation. Okay, when we'll be launching the product, then after that, how you'll be generating the revenue with that, because you have to invest everywhere. You have to invest, then after that you have to earn profit. That is how the marketing actually operates. More things, if you want to ask Dr. Shiva, if you want to add something on that.
If you are really interested in marketing kind of job role, you had good future, but a little traveling will be there every now and then. I had visited within this 1 month nearly 12 big hospitals with more than 16 branches each. It's like we had to go over CEOs, we had to go and talk with them, you had to build some relationships with them in marketing. When it comes to sales, many people don't like sales jobs. They feel like very downgraded and all. It's not like that. Once you are into the field or in the market, you will get to know that the jobs are very good. And one more thing is the IT job. There is a healthcare IT specialization here. This IT specialization leads you into healthcare tech firms. You yourself can build an app using it. You can develop as business analyst. You can be in the roles of manager roles like quality assurance manager, business assurance manager. Many roles are awaiting for you.
But eventually, sales and marketing are interlinked. But we need to achieve the marketing strategies in terms of the sales process.
See, currently my role is like I'm a business development head. To be frank, the head himself goes to field sometimes if it is needed, and if the meeting is with CEOs or and all, and you have to strategize the business plan, how you will develop your business, how you will develop your company. You are like a key role, you are like a backbone to your company. If you are being a marketing person, marketing doesn't mean going and selling the products always.
Yes, so rightly said by Dr. Shiva, because he is doing, and it's his daily parcel and parts of life. So that is how the things are. Like, if you ask me that marketing guy also starting from sales only, at least 1 year you have to do sales. Then
Yes.
you'll be learning the nitty-gritty of the sales, like from where I have to start and from what I have to do, in which segment I have to strategize. There's one more term right now, it's buzzing around, which is digital health. Okay, like EMR, EHR, everything. So there is also requirement of marketing guys who actually promote this brand, strategize this brand, maybe the entire algorithms or maybe anything related to that blockchain technologies from where you'll be starting. And then after that, you are putting the repositories and all everything. And there is a sales guy who will be going and visiting the hospitals, who will be talking to the doctors and promoting the brand in their day-to-day life. And there is also a science or a research and development guy who will be actually working with hands-on along with the applications. It depends on what is your knack, what is your being background of that, being into technology, and how good are you in that technology.
Yes, sir. Thank you so much, sir.
Yes, any more questions? We are happy to help you out in here.
Every one of you are doctors here, right? To the max. Hello?
Yes, sir.
Then you need not worry. You had already gained the respect of the market here. Carrying a doctor tag itself is like straightforward into the market. You need not wait anywhere. You need not stop anywhere and see your back and all. I know how dentist life will be out of the college. I had faced it. That's the reason I came to IIHMR.
And one more thing is, suppose there is a doctor name in front of you. Okay, being you dentist, you already know almost 80% of anatomy, physiology, and then surgery. Okay, and you are actually not lower than an MBBS. You don't think in like that. But when you are talking about your product, you are the best person to talk about your product. Always remember this. Okay, if you are a product manager, if you are selling about that, or if you are building on applications, it depends on how good are you in that product. It's not about your basic qualifications, or it is not about actually from where you belong. Okay, because if I tell about myself, as Dr. Shiva was asking me, I belong to a very small city in West Bengal. Okay, if people even do not know, unless there is a railway factory, it is names is Chittaranjan. So the thing is, from there I did my schooling. Then after that I came to Bangalore, I did my pharmacy. And right now, after having 14 years of legacy, I'm teaching you guys. And then after that, I'm building up next generation who can build up apps maybe, and maybe talking about digital health. Maybe actually they can work on EHR, EMR, or maybe they are putting up IoT devices. That is what we are doing. That is what actually examples what we are creating or what we are developing. Okay, so I think thank you so much for all of you, and especially thank you, Dr. Shiva. You have joined and you have actually enlightened all the doctors here. So the thing is, it's up to you right now. You have to take your own decisions and you have to convince your parents or maybe whoever elder in your home. Okay, accordingly, you can take up any decisions, but take decisions wisely. The things are like it is your career, and we are here to help you out, to help your career, to show you the way, show you the path from where you have to go. You have to take the steps, isn't it, Dr. Shiva?
Yes, sir. Yes, sir. I completely agree with you.
Okay.
ఇంకేమైనా డౌట్స్ ఉంటే అడగండి పర్లేదు. We are here still. Any doubts regarding curriculum? Any doubts regarding sports facility at college, gym facility at college? You are missing out many things. You are not asking me questions.
Okay, one question has come like, how much can we earn after getting placed? See,
Kasukutti Shyam Teja, right?
yeah.
Shyam Teja, my CEO here, I am working in a Kasukutti private limited company. You can be the next CEO of the company. You need not worry about it. My CEO's name is Kasukutti Praveen Kumar. He is also a doctor. He has done his business in MBA Business Management. He has started this company. I'm working currently in that company. See, it completely depends on the individual. If you are willing to subside your knowledge and leadership, you will staying at low levels only. If you want to explore more, you will get more. Up to you, sir.
Yeah, so it is the thing is like, as once you have said about stage fear, you have to be fearless when you're talking, and like when you're talking, you should be meaningful enough, particularly to convince any people. Okay, so in that case, these things will be hand holding you to build up those kind of soft skills. Okay, be it in English, be it in like how you have to present yourself, how you have to present in front of 100 people or more than that. Okay, so that depends on this kind of equipment, depends on a lot of things, like how is your attitude about this kind of training programs, how is your attitude, how you will be taking up this kind of training programs, and then how much you learn. Okay, and after that learning, when you'll be applying in front of the interview people, like in front of the panelist of the interviews, then they'll be thinking that yes, you have something, we should hire you, we should take you as our next partner, we should hire you in terms of being into this package. So that time the panelist will be thinking that yes, I should not be let you go, I'll be giving you whatever you want. That time you can talk about your package. That time you can think that yes, this is actually my value here. That value creation is happening in IIHMR Bangalore. So you have to think in this way. Okay, my friend.
Okay, sir. Thank you, sir.
Okay, so thank you so much for patient listening. So I talk too much because I am from the marketing field itself. So that is the thing, and it's my job to actually teach you. So I'll be here as an assistant professor to all of you. Okay, so thank you so much for joining, and you have this contact number. You can contact even me also. So you can take up my number as well. It's 9886345519. Please note it down. Or otherwise, from the institute also, they'll be giving you, and you can contact in the numbers.
Chat box, I think.
Yeah. So chat box, I'll be just writing it down. Yeah, so you can reach out to me. Even you can WhatsApp me any queries, anything. Okay. And his number is also he has given. Okay. So any queries, he's your brother, elder brother. Okay. Thank you, Rajashekar. Thank you, sir. Okay, so we'll just log off right now. Thank you so much for patient listening. It's been 1 hour. We don't even know like how it's been passed, right, Dr. Shiva?
Yes, sir, seriously.
Yeah.
It's like just conversation between both of us.
Thank you so much. Thanks to all of you. Thank you.